I'm pleased to welcome everyone to this Greater Washington Regional meeting of our Commission to Study Mental and Behavioral Health in Maryland. I want to thank our host, Montgomery College, for having us this evening, providing the space for us to do this and to talk about this critically important issue. As I've said before, the subject of this commission that we'll be discussing and continuing to discuss over the next several months and actually years, it's not always an easy topic to discuss, but this represents something that I should say an opportunity for us to make a real difference in people's lives and to truly change and reform the way we deliver services to some of our most vulnerable citizens. I like to say it's far past due that we take a serious look at how we deliver mental health services. As I say, when I say how we deliver, I also include the federal system as well, not just our state. And it's something that I feel very strongly about and an issue that is close to my heart. Over the last 4 or 5 years, 4.5 years since the governor and I have been in office, we've been working to address the state's opioid issue. And I'd say I came to understand, many of you probably already understand the relationship between the disease of addiction and mental illness. Previously, I looked at these conditions as separate and distinct. And I've learned, and as many of you already know, that substance use disorder and mental illness are often co-occurring. And for some people, it may have been a situation where people were self-medicating, where they had undiagnosed mental illness. And so we want to make sure that we address these issues because they do not just affect the individual who is suffering, but also the families and their communities as well as their friends, I should say, too. So we want to take a fresh and serious look at how the state and the country, for that matter, bring care to individuals and families. And to that end, the administration created this commission, and the governor asked me to chair it. It was through an executive order earlier this year. And our goal is to identify ways to improve the services that affect many Marylanders that are suffering from mental illness and co-occurring conditions. And we're doing that by engaging families, advocates, practitioners, and those on the front lines of this issue.
I want to thank you for doing this, and I think this is a very important commission. I'll say I wish you had the abilities of the Kirwan Commission, because Kirwan's dealing with two sides of this problem, which is, A, what are the programs we need to move our children forward, and how are we going to pay for it? And the part that we need to confront, because I think we all know pretty much what we need to do. I think you all map out a reasonable way forward, and then the question is going to be, how do we pay for the reasonable way forward? And I would suggest that dealing with mental and behavioral health issues is as important as dealing with education issues. We're dealing with education issues because we lose these students in the beginning. We're losing people on the other end to behavioral and mental health issues. And both of them result in us not being able to take full advantage of the human resources that are available in our communities. When we lose people who can't do productive things, we lose the opportunity to take advantage of the skills and the intelligence they could bring to things, and we don't do it. So I hope that in the long run we really get to tackle the financial challenges that it takes to really fund some of the things that we all know we could and should be able to do. I'll just tell you a little bit of some of the fun things I've been dealing with, because I've seen this issue front and center this week multiple times and over recent weeks. I've talked with groups of high school students who talk about levels of depression and stress that I've never seen, and most people have never seen. I was regaled with stories of students who had breakdowns in school, were taken out of school by ambulances, and got to spend days in a hospital getting mental health support. And I went to school in Montgomery County, and that was not the kind of stories that people told about what was going on inside the high schools. And these kids, to a person, went around the room and talked about stress and the impact on their lives in school. And that's, I think, important that, we know we don't have the counselors or psychologists in the schools that we need to have in the schools. I was meeting with the community in Montgomery County the other day, and they were talking about the growing number of homeless and the problems they were presenting in the community, and more prominent behaviors, more behaviors that were disturbing, and talking about the impacts on the businesses and the residents that they were trying to attract there. But what I took as encouraging is they did not want me to arrest people. A lot of times and in other days, that would have been the conversation. Can you put these people away? And instead, they said, you've got to find a way to treat these people. They need help, and we need the resources to be able to help them. And we need programs to be able to help them. I operate one of the largest mental health facilities probably in the state. Not the largest, because I think you have a bigger one.
Second to our state
But
penitentiaries.
But ours, 1/3 of the people in our jail present with mental health issues. They really don't belong in jail. And if they got the treatment, if we were able to support them in mental health issues, they wouldn't be in jail. And the resources that we spend to put people in jail is enormous. And you got to wonder, if we took those same resources and put them in mental health, what would we get? And the same thing is true with homelessness. When I arrest somebody for not complying with not appearing in court and they get a bench warrant, what I'm going to spend to put somebody in a jail overnight or for 2 or 3 days is probably equal to what I could have put them in a good hotel in Montgomery County for a month. And they're going to go back and through this. We need more support for police crisis teams. We talk a lot about, more and more our police go out in the field. They encounter people who present mental health issues. They don't have the resources to deal with them. We don't have enough crisis teams to get there or get there in time, because what we have has to be in the right place and the right time to arrive there before an officer winds up doing something they would probably rather not do. And these are real life and death decisions that get made, simply because in some cases we weren't able to get the right resources to that place at the right time. So these are all real things that we deal with. And the last thing I'll talk about is knowing people in the mental health who deal with folks who present both disabilities but also mental health issues. And some of them receive services, but if their allocation for services runs out because they've spent what the agency can spend in dollars on getting a person in front of a psychiatrist or whatever the help they get, they will go for a period of time until the next cycle begins for their funding. And I've heard people say that what they hope is that they get arrested before they do something to hurt themselves or somebody else, because they go through a period where their mental health declines and it's not being treated, and so what you hope for is they wind up in jail. That's not what any of us want, and it's not what they want. So I'm here just, I see the human face of this all the time. I know from your resumes and what you've done, you all see the human face of it. So I want to encourage you, to work on developing plans that more effectively help us address these issues in the community. And to the extent you can, we need to get our legislators to summon up the courage to provide the funding. This is a bipartisan problem. I can't point to any administration that fully addressed these issues. So this is just simply, we've not faced up to stuff. It's time for us to face up to it and figure out what's it going to take in resources in order to do the right thing for these people, because ultimately it's going to be the right thing for our community. So thank you for giving me a few minutes, and I really do appreciate the work you're doing.
Lieutenant Governor, let me just say thank you. As chair of the Education Committee for Montgomery County, but also as the chair of the Education Committee for the Maryland Association of Counties, let me just stress what you talked about in terms of the importance when it comes to our young people and ensuring that their mental health is paramount. It really is one of the things where was just reported about chronic absenteeism when it comes to Montgomery County Public Schools, one of your largest, the largest public school system in the state of Maryland. And quite honestly, as I can tell you, in being able to spend a lot of time with a lot of our counselors as well as our school resource officers inside our schools, a large portion of that is mental health days. Our children are actually taking days off to where they're completely exhausted from the trials and tribulations that we didn't experience. I mean, as I heard you talk to the county executive, it's so true. The same thing exists even in my generation. It's a little bit later than yours, but still is the exact same thing to where we don't, it's just small, just a small window. But it really is one of those where we have to start to understand that these are the kinds of things to where parents are actually even calling in and saying, I need to have a mental health day for my child to get them away from the stresses and the challenges of what we see. And just as you said, and you commented about social media, I just want to highlight that and have us really reflect on the fact that if you're the person who has parents who are struggling to be able to afford the cell phone for you so that you can keep up with the Joneses, and then you hear and you see on Instagram all the great things that your other friends are doing and how your life is not the same. All it's doing is highlighting for them the differences in terms of where they are and different. And these are the things that we're hearing from our kids as you talk to them and say, this is even more so talking about how these kids' lives are so much better than mine. And my life is horrible. And my life isn't good because those kids are going on vacations and going on trips, and here I am stuck and can't do whatever. And so you're right, social media plays a key part, not in terms of just internalizing and making a front in terms of how my life is great and it's really not, and I really don't feel great about myself, but it also makes other people feel less positive about themselves. So just wanted to share that with you, something that we're seeing in our schools and when it comes to the mental health of our children, it's really something that we need to continue to prioritize, which really comes down to ensuring that we have additional counselors and resources inside our schools. So thank you.
Thank you. And Oregon recently, implemented mental health days. I guess I had a slight difference when I was reading about what Oregon did and just said that they should just be included with sick days and not, have to classify that it is a mental health day, and just fit into that. And again, not being the education expert, but one of the things that maybe our school systems, I was going to talk to Dr. Sammons about it, is that why not have mental health days at school where kind of all your classes, you talk about mental health. I mean, and it can be, and even relaxation exercises. I know they have to get through criteria, the curriculum, and they have to do the test and stuff like that, but there's time that even in a math class that you can say, we're just going to do third grade math today in high school or for the first hour. Here's a sheet just like what you had in the third grade, or second grade. It's just 1 + 1, and just something to let kids relax a little bit after they laugh for a while, but get them to relax, and then you go back into, but you can do that in your history class. You can do things in your science classes and talk about, like you said, brain disease, just things that can maybe lower the anxiety that some kids have. If anyone wants to submit comments regarding things that we should consider, you can send them, and I think we have the email address up here. Yeah. Do we? Yeah, okay. I never look up. And I'll say that we have a website. I don't know what the website address is, and it's sitting right on my head. Okay. So thank you, and we'll let folks know when and where. Like I said, we're planning to go west next time, and that'll be out on our website, and we'll put information out about it. So thank you again.